when they swore up and down to us that the COVID vaccine was safe for pregnant women. The COVID vaccine could be associated with miscarriage in the first trimester.
Okay, we need to talk about Dr. Fauci and this diary entry about miscarriages. That was Priya Patel. She's a brown woman who thinks that if she embraces Trump and MAGA and anti-vax pseudoscience,
No, in fact, us Americans had it shoved down our throats.
that they will forget that she's brown and won't make laws that turn on her. I'm Joe Thomas. I use social media to talk about public health and fighting misinformation. I've gotten comments about this on multiple platforms, quoting this diary entry, this text message, Dr. Fauci talking to colleagues about fevers and inflammatory responses that happen after vaccine doses. I guess specifically the second dose in this case. He says that those fevers could be associated with miscarriage in the first trimester. Any fever in the first trimester of pregnancy can potentially result in miscarriage. Not always, but it can happen. This diary entry is not a confession or admittance of any kind of lie. This is a scientist sharing a thought that he had with colleagues. This is how scientists and doctors come up with research questions. Then they actually did the research. See, most pharmaceutical products, vaccines, medications, whatever, are not usually tested on pregnant folks in the first trials because pregnancy has too many variables, including the fetus. However, inevitably, some people in the trial and in the initial rollout took the vaccine and then got pregnant or didn't know they were pregnant when they got vaccinated, and then eventually they do a proper study looking at pregnant women who did and didn't take the intervention, in this case vaccines, and look at outcomes. You have to outline the outcomes you're looking at in a study protocol, and your results are compared to the hypothesis that you initially propose. This is how you know Bobby Kennedy is bad at science, and Priya too, because when he talks about the studies he did to make the proof,
we're doing the studies to make the proof.
A congressperson asked him about study protocols, and he had no answer because all he does is cherry-pick data. Speaking of cherry-pick data, you might have heard about this study that Pfizer supposedly hid, where they found that 82% of pregnancies that vaccinated had a miscarriage or spontaneous abortion. That's a pregnancy loss before 20 weeks. That's a gross misinterpretation of the data from the study. Again, this is why study protocols are important. The study looked at a certain group, including all pregnancy outcomes from people that got vaccinated in any of the 3 trimesters. Anti-Vaxxers tried to remove all the participants that got vaccinated in the 3rd trimester, which narrowed the denominator without adjusting the numerator. But you can't just take out a bunch of participants when the study looked at a certain set of outcomes. You have to redo the tables entirely with a different question and different analysis. So that 82% figure is a total lie. The bottom line is, multiple trials showed that there was no difference in the rates of miscarriage between those who vaccinated while pregnant and those who did not get vaccinated. It didn't affect conception either. There is a colossal difference between one man's musings in his private diary as he tries to figure out what research questions to ask, and then the actual scientific research that gets done. People who claim to do their own research sometimes confuse the two.